This was when we had to wait for her to wake up.
This is baby Isabella coming round from a general anaesthetic in January, but her operation hadn't gone ahead due to a shortage of staff. She had to wait another week for surgery for a rare condition that affects her colon. Then, earlier this month, she became ill again, so her mother took her to hospital in Dudley.
While going into A&E, you are distressing because what's going wrong with your daughter who had just operation? So we went into A&E, and it's just a constant waiting.
The series of delays have left her mother concerned about the impact escalating strike action could have.
I don't blame the nurses, doctors, they do their job and they're brilliant, but obviously they're also under stress. If more stuff goes on strike, I don't know how that's going to work. Like, honestly, waiting for long hours because there's not enough staff. Somebody really should step in and do something because there are people and children stressing and suffering in hospitals.
The Royal College of Nursing is preparing to intensify action, which could see staff also walk out of emergency departments, intensive care units and cancer wards. But Roman is a nurse who works with cancer patients. Aren't you concerned with this escalation that actually patients are now just going to feel very frightened about how their care will be affected?
I think my patients know that this is necessary and they're standing in support behind us. I see patients appear on the picket line saying, keep on going, this is for us, we know you do this for us.
Don't you risk losing that support by escalating this?
I hope not, because I hope the public will understand that this is in the hands of the government.
New strike dates could be announced within days and take place in the coming weeks. NHS Providers, which represents hospital trusts, has said it's alarming and warned the only way to avoid more disruption is fresh pay talks. A government spokesperson said the Health and Social Care Secretary has been clear he wants to continue discussing with unions what is fair and affordable. He continues to urge unions to call off strikes and engage in a constructive dialogue about the pay review body process for the coming year. Like many patients, Isabella's mother just wants the row resolved, so there's one less thing to worry about if she falls ill again. Becky Johnson, Sky News.